what is all this? Here we are again, another Kellyology for you. So I want to talk about angina versus myocardial infarction and the primary differences between the two. Before we get into that, it's really important that you kind of understand arteriosclerosis and atherosclerosis. Arteriosclerosis is something that happens over time. It comes with age. You notice in this particular artery that we have here, there's not any plaque buildup or any of that stuff, but the patient may experience arteriosclerosis. And what that is, it's a hardening of the arteries. So the arteries are like this rubber band, and whenever the body needs more oxygen and the heart pumps harder, they stretch so that they allow the pressures and everything to get through. There's some laws on physics laws that you can look up, but ultimately your arteries are like rubber bands, so they stretch. Now in arteriosclerosis, they become more like this string, and they don't stretch. So that is going to reduce the amount of blood that can flow through it. So if you've got the same size vessel, but you're trying to push more fluid through it, it's not going to stretch. That's what arteriosclerosis is. Now, atherosclerosis is where you get the hardening of the arteries due to plaque buildup inside the arteries. So, for example, a patient who has arteriosclerosis may have a stretching or the vessels don't stretch. So this particular patient we're going to assume they have arteriosclerosis and they've had some plaque buildup. So notice how the vessel still pretty much remains the same size. And what's most important is the lumen, the area between it. This vessel will not allow enough blood to flow through. So that's what arteriosclerosis, and this would be more specifically the atherosclerosis. Let's look at a normal blood vessel that, let's say, a young healthy person who starts getting plaque buildup inside their vessels. Notice how this vessel stretched out, and ultimately the lumen stayed the same size. So as the body needed more oxygen on this side and this plaque started to build up, the vessel actually stretched so that it remained the same size inside. Now that's a normal artery that allows it to stretch, versus the arteriosclerotic vessel that as it tried to pump through it, you can see the narrowing of the arteries. So what happens is the arteries narrow. And by doing that, it reduces the amount of oxygen that can be delivered at the end of that. So that's arteriosclerosis and atherosclerosis. The big difference between atherosclerosis is a form of arteriosclerosis. So ultimately what you're getting here is a hardening of the arteries and they don't stretch. So let's talk about angina. Angina or angina, it is something that occurs with people who have arteriosclerosis or atherosclerosis in their coronary arteries. So what we have here is we have the heart and we have the main vessels that feed the heart. Okay, so whenever these people start working out, whether it's just walking across the road or exerting themselves in any way, their heart starts to increase. Their heart rate starts to increase. It needs more oxygen. Well, what should happen is the vessels should stretch. These vessels in here should stretch to allow that oxygen to get through because the body's trying to feed the heart. Unfortunately, when they have arteriosclerosis, that vessel does not stretch. So what happens on the end of that is the vessels that do not stretch start to, or don't start. What happens is the area that those vessels feed actually starts to get hypoxic, or what we call ischemic in the heart. So it's not getting enough oxygen. So by doing that, what's happening here is the heart's not getting the oxygen it needs, so it starts telling the body, I've got a problem. And it does that with the same signs and symptoms that you run into with a heart attack. The difference between a heart attack and angina is angina goes away with rest and nitroglycerin, because nitroglycerin opens the vessels up and it will get rid of this area that's ischemic. So this person starts walking and they start getting short of breath and start having chest pain, chest pressure radiating into the arm, up into the jaw, feel like they're short of breath. So they are doing that because their vessels are not stretching like they should. They should stretch to allow the body to get more oxygen, or the heart to get more oxygen, but in this particular case, they're not stretching. So that's where you get the ischemia. Now, once you sit down and rest, and the heart starts to slow back down and everything starts to get kind of normal again, this goes away. So ischemia can be reversed. Okay? That's very important to understand. Ischemia can be reversed. Now, let's talk about a heart attack. What happens in a heart attack is one of either the plaque, generally it comes from the plaque, but really it could be an embolus, it could be anything that gets in here. And it comes down in here and it blocks that artery. Okay? When it blocks the artery, the blood flow no longer can get through that artery. So let's say it comes down and same exact situation, it blocks this artery right here. Well, that's going to block all of these arteries, and you're going to end up with the same thing. Shortness of breath, chest pressure, generally radiating into the left arm, up into the jaw, in the neck. They'll have shortness of breath. They change, skin color changes, all of that stuff, because they're getting ischemic right here again. Now, the difference here is this will not go away with rest and nitroglycerin, because there is an occlusion. There is something blocking that. So this starts with ischemia, and it's extremely important for time. Time is of the essence in these circumstances, because this ischemia can be reversed, but only after a short period of time. The other is infarct. Okay? Infarct is dead. So this part of the heart starts to get ischemic, and if we can get them to a cath lab soon enough, they can go in and get that clot, open those vessels up. Sometimes they'll have to go in, pull this clot out, and open the vessels. They may actually go in and put a stent in that will open the vessels and prevent other clots from coming through, also prevent the vessels from collapsing, and it can reverse that. However, if it doesn't happen soon enough, then that part of the heart will die, and it will be gone, and it does not regenerate. And that's what an MI is. It's a myocardial infarction. That part of the heart is dead because it's lacked oxygen for too long, and you end up with changes. You'll see changes in the EKG. Those things happen when you get in an infarct. Ischemia is the same thing. You can see those changes in the EKG, but that's beyond the scope of an EMT to be able to understand. But that's the difference between an angina and a myocardial infarction. Angina is generally induced by some type of stress, and it goes away when they rest and take nitroglycerin. Myocardial infarction generally comes on. They could be doing some type of stress, exercise, anything like that. They could be sleeping. They could be resting, and the pain just all of a sudden comes on. Same symptoms. chest pain, pressure, heaviness in the chest, radiates down on one arm or the other, up into the neck. They may feel like they're having trouble breathing. The same exact signs and symptoms. The difference between the two is with angina, it goes away with rest and nitroglycerin. I always tell everybody, though, we do not diagnose angina and myocardial infarction. If a patient has never been diagnosed with angina, then they need to be seen by a cardiologist whenever they're having chest pain, because that is something that the cardiologist needs to confirm, make sure that it is not a myocardial infarction. But people with a history of angina, they will know the difference, and they'll know to take a nitroglycerin, rest, and that generally relieves the pain within 10 or 15 minutes. So remember, arteriosclerosis is a hardening of the arteries. It prevents the arteries from stretching. That is the difference between the rubber band that naturally stretches like it should, and the rope, which would be the vessel that does not stretch because it has arteriosclerosis. The buildup of plaque inside the arteries that creates that and creates the arteriosclerosis and prevents the vessels from expanding, that is atherosclerosis. That's the difference between the two. Again, arteriosclerosis will reduce the blood vessels' ability to provide oxygen to the heart. And in this example we have here, because of the plaque, it doesn't allow the vessel to push as much oxygen through, which can create the ischemia. Same signs and symptoms of a heart attack. However, they go away without any additional treatment other than nitroglycerin and rest. A myocardial infarction is where something blocks the vessel and prevents oxygen from coming in, and that requires advanced care to be able to get that blockage out so that that part of the heart does not die, and that is very time sensitive. So it's extremely important for rapid transport, and specifically to a facility that has a cath lab. It's called a PCS facility, where they can go in and get that clot. That's the definitive care. If the closest and best thing you've got is a facility that can give some type of what we call clot busters, then that may be the only option the patient has. But definitive care, the best care, is for them to be able to go in and get that with a cath lab. That's the difference between angina and myocardial infarction.